So diabetes basically means that our body basically loses the ability to process sugars properly. So what happens in this is our body cells cannot take up the sugar without the insulin. So they have a lock. The insulin works as a key. One is if our body is not producing insulin, which is a type 1. And second is our body produces insulin, but our body is not able to, or rather the insulin is not able to work properly. That is normally seen in type 2. And the third important type is a gestational diabetes. But what we try to emphasize more on is the modifiable risk factor. A very important one is, the most important is diet. So what happens is, as our fat increases as we gain weight, our ability to use that insulin reduces. So we'll end up in insulin resistance. Third is physical activity. Okay.
I think diet, exercise and sleep.
If we can manage, monitoring sugars every 3 to 6 months becomes very important. But there's another test which will tell us very clearly that whether you're diabetic or not. This excess sugars can affect your heart. It can lead to heart attacks. You don't need to get scared. What you really need to do is keep your sugars under control. Hello everyone. Welcome back to the Health Talk, where we dive into all things health, wellness and lifestyle. But today's episode is a little bit different. Usually, I, Dr. Sagurika Malik, am your host. But today, the tables have turned. I am on the hot seat.
That's right. With over 30 years of experience as a family health practitioner and lifestyle disease coach, she is here today as our guest, ready to share her insights on a topic that is extremely close to her heart, and that's diabetes. So sit back, relax, and join us as we switch things up and she gets to answer all the questions. Let's see if she's as good a guest as she's a host.
Right, Dipta. So bring on your questions.
Sure. So, all right, doctor. So, let's get down to the basics. So, as everyone would like to know, in simpler terms, what is diabetes?
So, diabetes basically means that, our body basically loses the ability to process sugars properly.
Okay.
So, what happens is, as we eat, our food gets digested in the intestine.
Right.
And then the intestine then converts the food into glucose. This glucose gets absorbed into the blood.
Correct.
So then the blood sugar increases. Now as the blood sugar increases, normally what happens is our brain tells our pancreas. Our pancreas is an organ in our body which secretes the hormone insulin. So our brain will tell the pancreas to secrete the hormone because the blood sugar is increasing. And this pancreas then helps the sugar to enter the cells in our body from the blood. Then what happens? The sugar from the blood enters the cell, the blood sugar drops, and again the signal goes back to the pancreas to stop secreting the insulin.
Okay.
So what happens in this is, our body cells cannot take up the sugar without the insulin. So they have a lock. The insulin works as a key. So without the insulin, our body cells cannot take up the sugars. So if this happens on a regular time, for a chronic time, then chronically our blood sugar stays high and we'll end up with diabetes.
Right, doctor. So thank you. So we've now understood the definition of diabetes.
Right.
But as we see, I've heard a lot of people talking about various types of diabetes.
Right.
And so irrespective of ages as well.
Right.
So can you just explain that in detail?
Right, sure. See, as I was telling you that for the blood sugar to enter the cells, we need insulin.
Correct.
So there are basically two main types of diabetes. One is if our body is not producing insulin, which is a type 1.
Okay.
And second is our body produces insulin, but our body is not able to, or rather the insulin is not able to work properly. Okay. That is normally seen in type 2. Now in type 1, what happens when I say not producing enough insulin? Our body makes mistakenly some antibodies against their own pancreatic cells. So it destroys its own pancreas. Then what happens? The insulin producing cells get destroyed. Then obviously the pancreas are not producing cells adequately. And then the person has to rely on outside insulin. So the person has to stay on insulin injections.
Right.
And this is we see commonly in younger people, like smaller kids, younger adults. We catch them much earlier.
Right.
Okay, so this is type 1. Here they have, it is also called as insulin dependent diabetes, because person is dependent on the external insulin. And the second, as I was telling you, is the insulin non-dependent, which is the type 2. This is the most common type of diabetes which we normally see.
Okay.
It is usually seen in much older adults. But nowadays, unfortunately, we are seeing this even in younger people.
Right.
And this is because of lifestyle changes.
Absolutely.
Okay.
Correct.
So what happens is, here the body is producing insulin. But because of the inactivity in the body, our fat cells, our liver cells and our muscle cells, they are not able to take up the blood sugar from the blood into the cells. So the blood sugar stays inside the sugar stays inside the blood. And we call this situation insulin resistance.
Okay.
Okay, so here the sugar is also high, the insulin levels are also high, but still even the high levels of insulin are still not able to help the sugar to enter the cells.
Okay. They stay in the body, but they do not work.
They do not work properly.
Okay.
So then what happens? The pancreas get tired of secreting extra insulin. So the initial phase, we may help the patient with the help of lifestyle changes and medicines. But since the pancreas get tired of secreting a lot of insulin, after some time the pancreas will stop secreting insulin.
They give up. Yeah.
They give up, So then that's why later in the life, even type 2 diabetic patients, they land up with insulin.
Okay.
In addition to other medicines. And the third important type is a gestational diabetes,
which is quite common.
Which is quite common.
Yeah.
And it is becoming more and more common in the, people. And obviously the name suggests it's gestational, means this diabetes happens only during pregnancy.
Correct.
And the diabetes settles down after childbirth.
Right.
Okay. But the problem is you become more prone to type 2 diabetes later in life.
Okay. But for most of them, it does become a lifelong.
Yeah, but that's what I said. See, what happens is after pregnancy, gestational diabetic patients are more prone to type 2 diabetes, because what happens is we increase their risk factors. They are, first only they are genetically prone to get the diabetes, and that is the reason they are getting the gestational diabetes. And after the pregnancy, what we tell is, you take rest, you don't do physical activity, you eat so much, because pampering, a lot of pampering happens.
True.
So what happens is and then the lady starts gaining weight. So then, we are increasing her risk factors of getting the gestational, from the gestational diabetes it goes towards type 2 diabetes.
Right.
So it becomes very important, if you're having gestational diabetes, you should keep checking yourself every 6 months after delivery to see whether you're going towards type 2 diabetes or not.
Okay. Can that be prevented?
Oh yeah, that can be prevented.
Okay, doctor. Since you've mentioned that there are a lot of complications and risk factors involved, now can you explain how can we prevent that, and what are the most common risk factors?
Yeah, so when we talk about diabetes, we have to understand that there are two different types of risk factors.
Okay.
One is a non-modifiable and one is a modifiable. Okay. Now, as the name suggests, non-modifiable, we don't have a choice over it. Like suppose we are born with genetics of getting diabetes. Our parents are diabetic, our grandparents are diabetic. So we are born with it. We can't change our genes.
So that's a permanent.
You can't really help that, So that is one thing. Second is, as we age, our risk increases. Now, how much ever we want to keep ourselves looking young, we still age. Right? So, whether we like it or not, our age increases, our risk increases.
True.
So, third is, non-modifiable would be important is our race. We Asians are much more at risk of developing diabetes because again of our lifestyles. Our lifestyles are different, our diets are different, so that is what is.
Okay. Is this a proven fact?
There are studies which show that Asians are more at risk. Okay. And so now these are the non-modifiable. We don't have a choice over it.
Right.
But what we try to emphasize more on is the modifiable risk factors.
Right. What you can.
It is in our control. What we can choose to do. Okay. So the modifiable risk factors again are very important. One is the most important is diet. What do you eat? Okay, whether you eat a normal balanced healthy meal or you are eating junk food a lot or you're eating a lot of highly processed sugars,
Correct.
highly processed fats, So these are very high calorie stuff. So what happens is the body's blood sugar, we have a high spike of blood sugar. Obviously, as I was telling you, the pancreas has to work harder.
Correct.
It gets tired, and then our body is not able to manage those high sugars. Now, this diet also, what will it cause? It will cause weight gain. So as we gain weight, I was telling you about insulin resistance, right?
Correct.
So as we gain weight, our fat cells are increasing in our body, whether it's in our body, around the muscles, around the liver. We heard the word fatty liver. I'm sure you have heard the word
Correct.
fatty liver.
Yes.
So what happens is, as our fat increases as we gain weight, our ability to use that insulin reduces. So we'll end up in insulin resistance. There is an insulin, the body is secreting insulin.
Okay.
But we are not using it properly. The insulin is not able to put the blood sugar into the cell.
Okay.
So then again the blood sugar increases. Okay. So then again, so one is diet. Second is weight. So you can always try and manage your weight. You try and keep yourself within the normal weight range. Third is physical activity. Okay. Now,
which is quite.
See, nowadays the life has changed. Okay. The life has changed. We are becoming more sedentary.
Yes.
We are hardly moving whole day, 9 to 5, 9 to 9. We are just sitting and working.
And
We don't have.
Like, post-COVID, the entire system of working is changed completely.
Absolutely. Because we have started working from home.
Exactly.
So, you're sitting in your bed, you're sitting in your sofa at home, you're just not getting up from there.
Yes.
So, this physical inactivity plays a havoc in our body, and it creates insulin resistance. But that is in our hand. We can change it. We can start doing physical activity. 4 is another important thing is stress. Everybody is stressed nowadays.
Including kids.
Including kids. Even a school-going kid is stressed.
Yes.
Okay. So stress, why is stress important? If we stay in our stress, stress is good for us. To perform in life, stress is important.
Good stress.
Good stress.
Yes.
So, but what happens if this stress continues for a long time? Then our body, what happens? It starts secreting another hormone called cortisol.
Right.
And this creates more and more sugar secretion from the liver. And then our blood sugar keeps increasing.
Okay, this is a nice point.
So then what happens is, again the insulin resistance increases. So our body is not able to handle the extra sugars.
We fall into type 2 diabetes.
So we again fall into type 2 diabetes. Okay.
Yes.
The 5th very important part is sleep.
Okay. I think diet, exercise and sleep.
If we can manage,
yes.
if we can really manage these factors well, then we can prevent diabetes to a large extent. At least even if you are not able to prevent, suppose if you have a very strong genetics, then you may not be able to completely prevent it, but at least you will be able to delay it much longer. So that's why I would say that it is best to take care of your lifestyle choices. Make a healthy choice, and that will help you in preventing diabetes or at least delaying it further.
Absolutely. A healthy body is a healthy mind, So
yes,
definitely.
Yes, we need both.
That's 3 takeaway points from you, doctor. Thank you so much.
Yeah.
So, doctor, now that we have understood the diabetes very well, its type and what are the risk factors and how you can prevent it, another important thing is, how can anybody understand what the signs are? How does the diabetes start? What are the symptoms? Or can we understand in a family members that we look at a person, we can say that they're getting inclined towards diabetes? How do we take those tips for understanding the symptoms?
Right. So let's understand one thing, that diabetes, as I said, is a very chronic disease. It starts very slowly. So initial phases, you may not really understand at all. There are no as such signs of diabetes, typically signs of diabetes, unless the sugar really increases to a certain extent.
Okay.
So that is the reason why we say is, that monitoring sugars every 3 to 6 months becomes very important, especially if you have a family history of diabetes, right? So that is something very important. Monitor your sugars every 3 to 6 months. It's a very simple test. Now, suppose, we have not monitored, and as you are saying, what kind of warning signs or some symptoms which we can look out for. Okay, there are very simple things. One is suppose if you get a non-healing wound. Very commonly we catch diabetes that way, See, normally, Dipta, if you cut yourself, you will heal within 5 to 7 days maximum.
Correct.
Right?
The healing period is longer. when it
So
comes.
what happens? Yeah, the healing period. Suppose if your wound is not healing even for 2 weeks, 3 weeks, then definitely suspect that there could be diabetes. Okay, so please check for it.
Take
A
away.
non-healing wound. Okay. Second is extreme fatigue for no reason. If I have not slept well, or there's too much of stress in the office, and that is the reason I'm feeling tired. But if you feel that your tiredness is unusual, again, please get yourself checked.
Okay.
Okay. Now that is one more thing. Third is sudden weight loss.
Okay. You lose weight.
You lose weight sometimes,
Okay.
suddenly, without any reason. You're not trying to lose weight. And why does that happen? Because again, as I said, the sugar lies in the blood. It is not going to the cells.
Okay.
So the cells are still starving.
So they don't.
So
get
they are not getting the nutrition. So
Yes.
they're not getting the glucose. So then you start losing weight. Okay.
Okay.
Because the cells are not getting sugars, the very standard symptoms which everybody thinks is, feeling of excessive thirst, feeling of excessive hunger.
Okay. You lose weight, yet you're hungry.
You're hungry.
Okay.
You keep staying hungry, you keep eating, and in spite of that, you're losing weight.
Okay.
Okay, so that is those are the kind of symptoms. For ladies, especially, urinary tract infections.
You catch the
Common urinary tract infections.
Okay.
If you're commonly suffering from urinary tract infections or vaginal infections, please check your sugars.
That's very
Okay,
very
so
valid.
these are some common signs and symptoms of you start getting headaches, you start feeling weak, tiredness. So all these symptoms together. That's why they are very general symptoms.
Right.
But you have to keep a thing of a suspicion in your mind that okay, is this normal, or should I get myself checked for sugars? So the best thing is, even the slightest suspicion, get yourself checked for sugars, because the sooner we catch it, the earlier we manage it.
Correct. And
you handle it in a much better way, and you prevent the complications.
Can dental also give you signs of diabetes? Because I've heard a lot of people saying
because
that,
dental infections, again, as I said, sudden dental infections, gum infections, tooth pains, these kind of things also, many times, basically whenever patients come to us with fever, and for a general infection, a respiratory tract infection or some other infection, so we generally always try to ask for a sugar. And if they are high, then, and many times we catch it like this, very incidentally, like, there's no specific sign or symptom,
Right.
but incidentally we catch the sugars which are high.
Okay. Even in younger children.
Or even in younger children. Because as I said, type 1 diabetes is caught in younger children only.
Okay.
And in type 1 diabetes, actually in children, you do see those, excessive thirst, excessive hunger, and loss of weight. This is very common in children.
Because sometimes it's very common for us to, mistake that, there's a school going children, so they are a lot of into physical activities, into sports, and, that's why they, drastically lose weight. But we don't look at the medical point of view.
Yeah. We don't want to assume a small child having a diabetes, so we don't want to think it in that direction. But it is better to keep a suspicion and get it ruled out. That is very important.
Great, doctor. This was it was sure an eye opener for a lot of us. With simple points that what doctor suggested. All right, doctor. Now that we have come to this part of the show. Now, how do you diagnose this, and how do you take this further for a higher management?
Right. Diagnosis of diabetes is one of the simplest way to diagnose,
Okay.
So, there are 3 simple blood tests which will tell you whether you're becoming diabetic or not. Okay. So, one is a fasting blood sugar. Now, if your values are lying somewhere between 70 to 99, then you are normal. 100 to 140, it becomes pre-diabetic, that is, you're going towards diabetic but not yet diagnosed as diabetic, and above 140 we take it as diabetic. Now this is one method. The second would be postprandial blood sugar. Okay, now this is after food blood sugar. This we check it between 1.5 hours to 2 hours after taking your food, and again the values are like less than 140 is normal, 140 to 199 is pre-diabetic, and anything above 200 is diabetic. But what happens is, many times people restrict their diet before doing this test. So then what, these values can come low, because people don't understand that they are, before coming to the doctor, if the doctor sees higher values, then they diagnose us as diabetic and put us on medication.
Right.
But they don't realize that they are fooling themselves, not the doctor. But there's another test which will tell us very clearly that whether you are diabetic or not, and that is the HbA1c, which is telling us the 3-month average, the previous 3 months, what you have been doing, eating, living, how your sugars have been. That HbA1c will tell us.
So that's the accurate result.
That is the accurate result. So then if it is anything more than 5.96, then it's pre-diabetic. More than 6.2, we take it as diabetic. Right. So there are very simple ways of diagnosing how diabetes, and then of course if we diagnose them as diabetic, depending upon whether they are pre-diabetic or actually highly diabetic, then the treatment management comes up.
Right.
The management comes up.
Right. But are there any complications associated with this? Now that we are talking about all ages, so even if it is young, juvenile, gestation, old age, say right from 10 to 60 or 80, if you assume.
Right. Of course. So if we don't treat as I was telling you, we have diagnosed a person as diabetic, but if we don't treat it, then it becomes, of course, then there are a lot of complications which can come up. Now, before I talk about complications, let me tell you simple ways of treating the diabetes.
Right.
Okay, so what happens is, again, since diabetes is more, the moment we say it's a lifestyle, obviously there are lifestyle factors which needs to be managed. So diabetes can be managed in 3 different ways.
Okay.
One is taking care of your diet, one is taking care of your exercises, and the third is, if you don't take care of these 2, you will end up with medicines. Right. So, and medicines, there are many different types of medicines available. So we can definitely try and take care of diabetes with that. But if you still don't take care and you neglect your diabetes and you don't take care of your lifestyle at all, then your sugars keep increasing. Then after some time or after a few years, you will end up in insulin. If you want to prevent that, do take care of your lifestyles and do take care of your diet and exercises. Okay. So now let's come to the complications. Suppose if the diabetes, as I was saying, if you don't take care, there are many people who don't take care, they take it very lightly. But then there are some serious complications of diabetes. This excess sugars can affect your heart. It can lead to heart attacks. Okay, we call it as coronary artery disease. What happens is it causes blocks in the vessels and we can land up in a heart attack.
Okay.
Excess sugars causes block in our vessels in the brain. So it can lead to strokes. We can have paralytic strokes.
It's not a minor complication, it's a
major complication. And it can affect your whole life. So then it can affect your eyes. So you can become blind if your sugars are not taken into control. It can lead to kidney damage. You may land up with a situation where you may need dialysis or a kidney replacement. You can lead to diabetic foots because the vessels of the foot get blocked, and then you get ulcers, and then you land up with amputations. So they are not small complications. Understand, they are huge
damage. It's a multi-organ damage.
It's a multi-organ disease. But you don't need to get scared. What you really need to do is keep your sugars under control. Take care of your diet, take care of your exercises. If you are already given medication, see that you are taking your medicines properly, and keep monitoring your sugars to see that your sugars are under control. Those things can help prevent all these kind of complications.
Absolutely true. Very, very important for all of us to keep in mind that you regularly monitor and consult your doctors on a regular basis.
Yes.
So I think this 80% of the diseases can be cured. So at least prevention is better than cure.
Absolutely.
That's rightly said.
True, very true. So if you can manage that, if you can keep your sugars under check, first of all, if you can prevent getting diabetes, secondly, if you have already got diabetes, then at least if you can keep your sugars under check, then you can live a normal, healthy life, proper life, and you do not land up with complications.
All right, doctor. So now that we have spoken much about diabetes and its serious complication, risk factors, and all other things involved. Now, just on a lighter note, considering all of us are Indians,
Absolutely.
North Indians and South Indians, that
Absolutely.
all of us are big time foodie,
Right.
And every month or probably twice a week, we have a lot of festivals and pujas coming up and all that.
Right.
And all of us have cravings of everything,
Absolutely.
especially when it comes to sweet.
Sweets.
So in that case, people who have this craving, but at the same time they have to control their body, their health and all that. How would you, a small tip, how you can suggest them to, have the craving as well as to control their body?
So basically, you want to have your cake and eat it too. Right.
Doctor, it's as simple as going to the gym and then going to another tiffin center to have your
Right.
idlis and vadas.
Absolutely, right. So basically, yes, we Indians definitely, we have lots of festivals. Nowadays the lifestyle has changed, so we go to a lot of parties, and wherever we go, Indians, for us everything revolves around
Fancy
food.
yes.
Everything revolves around food, right? So yes, so and poor diabetics, they're always worried, oh, I can't eat this, oh, I can't eat that, how will I visit, how will I enjoy the festival, how will I go to a party and all. So, but then you can still continue living your life, and enjoy everything. But one thing which in diabetics, one word which you should remember very strongly is the word moderation.
Absolutely. For everyone in general.
For everyone in general, and especially for diabetics. Okay. So everything is okay as long as we do it in moderation. Okay. So what happens is, yes, if you have to attend a party, say, then what happens if you go there? What you would do is you will control your portion size.
Right.
Take little bites. Continue, to chew your food well, take a longer time to eat that same food. And then what happens is, you don't end up eating excess.
And you get the feeling that you're actually...
Yes, you are still part of the crowd, you're still enjoying with the crowd, but still you're controlling your portions of what you're eating.
Right.
Second is, choose your sweets. So every sweet is not extremely high calorie or high sweet content, right? There is a gulab jamun and there is a kaju katli. So you choose what you want to eat. Why not both? Why not both, right? Okay. No, but that's what I'm saying. So you will have to choose your sweets.
Yes.
Second is, if you know that you have to attend a party, then it would be good that, you do some extra amount of physical activity before or after, do maybe extra half an hour of your exercises. Keep yourself well hydrated, because what happens is, many times we feel that we want to eat, but basically we are feeling thirsty.
Right. And most of the time we do fill water before eating.
Yeah. So then what happens is, just drink a glass of water before eating.
Right.
So automatically your stomach is a little satiated, Then one more thing is, choose the kind of food which, instead of going for, processed food like burgers and pizzas, or, ice creams, or those, you eat a little bit of salad first, eat a little bit of vegetables, eat your proteins, take your fiber. So try to balance your diet, okay? And of course, especially nowadays, I would do comment on this also, because in parties there is a lot of free flowing alcohol.
Yes. Absolutely.
So alcohol is a free calorie. When I say free calorie, it means that, normally when we are eating a food, our body has to spend some energy to digest it.
Correct.
Okay, so if I'm taking 100 calories and body is using 40 calories to digest it, then I'm getting only 160 calories. But in case of alcohol, if I'm taking 100 calories, I get full 100 calories. So that is the reason it is called as empty calories. So you just get it as much. So please restrict your alcohol intake, and that. So if you take care of these, I'm not saying don't do this, don't do that, because the moment we say that, don't do this, the craving comes in.
Correct.
So please remember the word moderation. You can do everything, but restrict yourself, and see that anything, if you're taking extra, then you're working it out.
Correct. Absolutely.
So
that makes sense.
Yes.
Yes.
So I think then you can still enjoy your parties, and you can still enjoy your festivals.
And those out there who are still wondering what has to be done every time you step out for a party, so you have to remember Dr. Sagorika's words, and there you enjoy your party.
Yes, so you can enjoy your party and still keep your sugars under control.
Thank you so much for tuning in today into this fun chat on diabetes. I hope our conversation has offered you insights and practical tips to prevent or to manage diabetes effectively. Remember, diabetes doesn't have to hold you back. Just a few healthy choices can make a world of difference.
Absolutely.
If you found this episode helpful, please share this episode with anyone you think might benefit or learn something new. And don't forget to follow us, The Health Talk, on YouTube. For more such health tips and discussion, let's keep moving towards a life of health and happiness together. Tata, bye-bye. Thank you, doctor.
Okay, thank you, Dipta.
Thank you. Thanks a lot. Doctor, one second. If you remember in the beginning of the show,
Right.
I mentioned that let's see if doctor will be as a guest, but if she will be as good as a host.
Right.
If you remember.
Right.
But I should tell you that you have nailed both the roles, and it was an awesome discussion that you actually took us through this episode, and you have proved it. So in the next episode, I wouldn't be asking anyone if Dr. Sagurika Malik is a host or a guest. It's up to you to guess. Thank you, doctor.
Thank you so much, Dipta. Thank you for that compliment.
Thank you.